Hi, everybody. Thanks for all coming. This is actually like a great honor for me because it's not often that you get to introduce your boss. Laura's one of my bosses in the pharmacy world to come present on motivational approaches. Laura's a clinical site leader at Toronto Rehab, and she also works with the family health team in the Immunodeficiency clinic. And she also does a lot of other work with pain management. She works specifically in like interprofessional teams in the chronic pain team at Toronto Rehab. She's also a mentor for pain management for the centers for CAMH. So Laura is a very busy person, and we couldn't be happier to have her here today. Thank you, Laura.
So it's my pleasure to come today. I'm quite honored. This is really exciting type of rounds, one that I mentioned, we have at UHN different silos, but we don't necessarily have one that includes everyone from the site or everyone from the hospital. So it's very new to me, so thanks for inviting me, Anthony. Motivational interviewing is something that I'm very passionate about. I use it in my clinical practice. I use it with my pharmacy team, and I find it's even creeping into a lot of my interactions on a personal level. My husband is like, "Are you doing that motivational thing?" every once in a while, and he's right, I am using it, and it just has really become a part of my communication style. And why I'm so enthusiastic about it is because I've really seen results. The reason I did motivational interviewing training was in my own practice, I felt really a need to develop some skills, some tools that I could have to reach for in like challenging situations, to really connect with people. And I have found that this has paid off in spades for me. My relationships are stronger with the people that I'm working with in clinic. And I just find in so many challenging situations, the tools I reach for tend to have a better outcome than what maybe my natural inclinations used to be. So I do want to acknowledge my mentors in the area of motivational interviewing, because as much as I've developed some expertise, I'm not an expert. We're all learning together. And so our goals for today, I really want us to be able to identify that writing reflex that so many of us as clinicians and others really feel, depending on our personality types. I'd like to introduce this motivational approach that I've learned and I use, and really describe some of these tools that I reach for to ask and listen and inform in an effective way. So what I wanted to start off with is a bit of an exercise in terms of how to be effective. Like, we're all right when we're giving advice and having conversations, but we're not always as effective as we could be. So I'd like for everyone to close their eyes, and this is an exercise I'm borrowing from Kevin King, and he's from Washington. And I'd like for everyone to think about something that you'd like to change, but you just haven't been able to change yet. Something that you're ambivalent about, that you probably should do, but you just haven't gotten around to doing. So thanks everyone for their reflection. And what I'm going to ask for is a volunteer, some brave soul who's very willing to share what it is that they're thinking about changing, but they haven't had time to change yet. And I'm actually going to ask them to share it with us and then step out for a quick minute. Is anybody willing to share?
I could share. I'd like to get back to swimming.
Okay. So you're interested in getting back into an activity that you've done in the past. Okay. Can you leave us with that? Step out for a minute. So activity is a good one. So I might lean on some of the other clinicians in the room. As a pharmacist, not necessarily right in my comfort zone, but what I want us to do real quickly is really think about some solutions and some consequences. So she'd like to get back into swimming. We don't know any other background. What are some ways that she could get back into swimming? Some ideas from around the room. Yep.
There's swimming at lunchtime here, so she could just start doing swimming at lunch.
Why doesn't she just swim at lunch, right? Yes.
Start small, maybe once a week and then build from that.
Okay, so small steps, right? Taper up over time. Can't help it, pharmacist, yes.
Maybe just find out what her barrier is that is limiting her from going back to it and then go from there.
Okay, so tell us what her problem is, why she started swimming again. I know that's not really what you're saying, but just paraphrasing it maybe in like, here, you do this. Okay, so tell us what's in the way. Yes?
Maybe she needs a swimming buddy, keep her counsel.
Okay, why don't you just find someone you can go swimming with? That makes sense. Yeah?
I was going to go along the similar route of suggesting a swimming class so she has a group and she'll have the motivation from others.
Sure, sign up for a group, pay ahead. That way you'll be motivated to go. That's another good solution. And there was a hand at the back.
Sorry. How to counsel her. What did it take to get there?
Okay. Okay, so that's great. Kind of getting into eliciting a little bit more as opposed to giving her a suggestion. So we're going to try and stick with giving her suggestions. I just want to see how she feels. And then what are some consequences if she doesn't get back into swimming that we could maybe remind her of? So I can already tell that there is a motivational spirit in the room because there's like a level of discomfort with framing it this way, which is great. It's like really great. But so what are some downsides of not getting back into activity?
She'll probably beat herself up. If it's something she wants to do and she's not getting back into it.
Okay, yeah. And more generally, yes?
Not doing physical activity can have effects on your sleep and that deep your sleep and have effects on your entire life. So.
Right. So there are lots of downsides to not getting enough activity. So why don't we invite her to come back in? We'll provide her with some of these solutions and see how that sits with her. Thank you so much for being our volunteer. Don't worry, we haven't been talking all about you, just about some solutions that we can offer you to get back into swimming. So I won't make you join me at the front because it's a nice group, we can all just share. So some solutions that we have for you, we think we can definitely help you fix this issue. So, join a class, pay ahead. What about that?
You want me to say it for real?
Sure. Yeah.
My inclination is to be like, great idea, guys.
I don't really like classes.
Okay. And what about just going at lunch? You have a pool here, I've heard.
It's too hot.
Okay. What were some other, what were some other solutions that we had?
Swimming buddy.
Swimming buddy. Yeah. Why don't you get a swimming buddy? Encourage you to go.
That's a really good idea. But I actually like to be flexible about when I go, and I don't know, I can't quite put my finger on it, but I don't think that would work.
Okay. That's awesome. I really appreciate that honesty, and thank you so much for volunteering. I know it's hard to put you on the spot like that. So we've given you some solutions, so I expect you to be 100% successful starting next week. You just take those and you go and you do it, right? Not really. So just a question, food for thought. What's the most effective way to help someone change? Is it about educating them on the reasons to change, listening to their reasons for not changing, talking about the consequences? So we tried as a group to come up with some consequences, and there were some really great suggestions, but I just felt like everybody, it was going to be hard to kind of throw those out there, a little bit artificial, and or teaching some ways to change. What does everybody think? Anybody for A? B? C? D? Okay, D. So the secret's out generally with this group. It's actually listening to someone's reason for changing is the most effective way to help someone change, but that's also in concert, of course, with some of these other strategies. So it's B+, is what we say. So I have a quick video just to get everybody's thoughts on.
Doctors, nurses, and physicians.
We don't need to hear their intro. Has anyone seen this video in the past called The Ineffective Physician? Awesome.
Wrote a prescription for an antibiotic for Aiden that should help infection, but in looking through the chart, I mean, it seems like he's had 6 or 7 of these just in the past year or so. That's really a big problem.
Yeah, it's pretty stressful for both of us. He gets really upset.
Well, one of the primary risk factors for multiple ear infections in kids is actually smoke exposure. Are you smoking?
Yeah, I do smoke, but I don't smoke around him. I try really hard not to smoke around him.
Well, the fact that he's having these ear infections is indicating to me that he is being exposed to smoke. And so, what can you tell me about that?
I don't know. I mean, I try really hard not to smoke around him. I don't smoke in the car. When he's home, I go outside to smoke. I know it's bad, and I know it's bad for him, so I don't want him to be around it, so I try really hard.
I really need you to quit smoking, both for your health and for Aiden. Did you know smoking around your child is associated not only with ear infections, it could get to the point where you have to put tubes in his ears pretty shortly here, but also things like vitamin C deficiency, cavities, like dental cavities, behavior problems, asthma, other upper respiratory infections. It's really putting him at a lot of risk. In addition to that, kids of smokers end up smoking themselves. Do you want him to grow up to be a smoker?
No, but I don't smoke. I've thought about quitting, but it's really hard, so I just don't know how to do it.
Well, now's the time to quit. It's really gotten to the point where you can't keep smoking. Not only for him, like I said, but also for you. You're putting yourself at risk for lung cancer, for emphysema, for oral cancers, for heart disease, for all kinds of things.
I know, I've heard. People have told me before, I've heard all that. I just don't know how to do it. How am I supposed to quit? It's so hard.
Well, there's all kinds of things you can use now. It's not as hard as it used to be. You can use nicotine replacement. There's patches, there's lozenges, there's gum, there's the inhaler, there's nasal spray. We can talk about medications. You can try Chantix, you can try Zyban. There's quit smoking groups you can go to. There's hotlines you can call.
Don't have time
There's
for
no
any of
reason
that.
why you shouldn't be able to quit. This is really important.
I understand that. I know it is. Everybody has problems, right? It's just really, really hard.
Well, what can be more important to you than the health of your child?
Okay. So, I can feel in the room, and I'm smiling too every time I watch these videos, because there's usually a level of discomfort around this interaction. So what I wanted to do is just explore that a little bit more, because we are all getting that feeling like this is not good, right? And that's why I don't even try and disguise this ineffective physician title. Somebody's asked me that before. Why don't you disguise it? Because it's so evident to anyone who sees this video. So, and then we might ask our volunteer, we'll just link it back to them. So was that physician right? Like, was the information that she was providing in general pretty right? Yes. So I'm seeing general yeses in the room. But was it effective? No. Okay, we all agree. So consensus. So what about her interaction did you pick out as either you thought that was ineffective or was making you uncomfortable, the way that she was approaching that? Yes?
Guilt tripping.
Guilt tripping.
Yeah, incredibly hard to watch someone be guilt tripped like that, because I'm sure she's heard it all before.
Hard to watch someone be guilt tripped like that. Yes, she's heard it all before. So I'm just repeating it so that everyone can hear. Yes, and new mom, right, with a baby, also incredibly hard to watch, because just, being such a vulnerable population, for sure. There are a series of these videos available, and I'm not saying that there are different levels of empathy that we feel for different people, but certainly new mom is right up there. Yes?
She wasn't listening to the parent. She just kept talking over it.
Right. It was very one way, the conversation, right? She was not listening skillfully, and it was all about one directional communication. I would totally agree with that. Yes.
It's like the not listening, she didn't validate any of her concerns, so she didn't acknowledge that it might be hard. She just said, well, there's no reason why you wouldn't. So the person wouldn't feel engaged in that conversation.
Right. The person wasn't feeling engaged, didn't validate anything about what they were saying or doing. She was totally dismissive, right, of any of her ideas. And, you know, I would add to that as well, she really didn't personalize any of those suggestions, much like the activity we did before, you know, not knowing anything about your decision or your plans or your trials in the past. You know, she wasn't really considering anything individual about that interaction. She was just generally listing like 100 ways that she could fix that, and so that's not very effective.
This is also like overloading her with information, and now your natural instinct when someone does that to you is to get defensive, like there's no reason why. She was like, well, everyone has a problem. So now she's like justifying her smoking, and she's not giving her space to, or creating a safe space for her to reflect on it. Instead, she's putting her on defense to defend smoking.
Thank you. That's really valuable. So even her style of informing was very poor, right? She was overloading her with information and making her extremely defensive from that perspective. And there was no opportunity for her to receive any of that information, right? So it was pretty much a waste also of time for both parties. So I would agree. Great observations. So enter motivational interviewing, right? Is, you know, with an attempt to overcome a lot of those writing reflexes and those ineffective styles of communication. Instead, motivational interviewing is collaborative, it's person-centered, and it's really a guiding communication style as opposed to a directive communication style, with the key objective to strengthen motivation and develop discrepancy and build on a person's individual reasons for change. And there is a growing evidence base for motivational interviewing. It's difficult to study communication techniques, of course, so there's varying levels of quality in terms of the evidence out there. But they have seen improvements, you know, when it's incorporated into a program to improve blood glucose monitoring, improve exercise compliance. For pharmacists, most relevant is usually to improve adherence to medication or decisions around stopping medication. And it's really about helping someone commit to a long-term change. So I mentioned, yes?
A question with the outcomes. So those are all very like clinical health related outcomes. Does it also create a more positive, like healthy communication environment, like the evidence around that?
So the question is there evidence around creating more positive health-related environment? And
positive communication and an environment for the family. So you leave, and one kind of communication could be quite positive, where another one maybe could be effective, but it's not positive at all. See one of the videos. So.
Yeah, so I think anecdotally, and Miller and Rolnick in their book really explore that and propose that this would improve rapport between people, improve the environment. Usually I am aware of some studies where it increases retention in treatment, and so that might speak to that, but I don't know about other individual studies. Retention in treatment is generally related to rehabilitation for substance use disorders, and also treatment for HIV management and directly observed therapy and things like that, older studies. So this writing reflex is something that I wanted to explore a bit more. So as clinicians and general fixers in healthcare, we often have this urge to really jump in and give advice and provide solutions and make recommendations that are going to fix all of the problems. Like, we have all this knowledge, if only we can use our knowledge and impart it to someone else, then they will be able to change as long as they understand what I understand. But this fails to recognize the fact that as healthcare providers, clinicians, and people who work in healthcare, we are also often patients, and sometimes we are the very worst patients, even though we have all that knowledge. And so the writing reflex not only is ineffective, but it can actually be extremely detrimental, making people feel very guilty. When I think about some examples, and we come by them honestly, we have the best intentions, but they can really work to shut people down and push them away from changing. Some examples that I've heard in my own clinical environment, and even for myself, is when we hear something that's not accurate and we say, actually, studies have told us, or, I'm sure you'd rather take this than end up in the hospital again, right? A little bit of that fear tactic. I've even heard people make it personal. Will you just do this for me? Just do this once for me and you'll see it'll be better. Or just the general, and we heard it in the video, smoking is bad for you for all of these reasons. Of course, we know that's not effective because otherwise our cigarette packages, like who would smoke, right? So motivational interviewing really asks us to do these 3 very basic communication tasks in a guiding style. And I'm going to go through some of the core MI communication skills. They use the acronym OARS, one of the many acronyms in MI, to really help us reach for these tools and types of phrases personalized to the person to ask, listen, and inform in a skillful, effective way. And so OARS is an acronym for open questions, affirmations, reflections, and summaries. And many of you are probably already using some of these tools in your practice. And, I certainly try and include them as much as possible. And as we advance further in the MI practice, it's about the balance between these tools. It's about using them at the right time to really move people as much as they can progress on that change scale when they are ready. And so skillful asking is something that we all feel we have a pretty good handle on, right? We have everyday conversations, we use open questions. This is one of those skills that seem very simple, but sometimes it's easy to move away from it. So I have another very brief activity. I will need some volunteers though. Can I get 1 or 2 volunteers? Thanks, Annie. She was on rotation at Toronto Rehab previously, so thank you. Anyone else want to partner with Annie? Come up to the front. Sure. Great, thanks. So come on up. So I'm going to task you with a conversation about resolutions for 2018. It's really timely. This is right in January. So we want to hear all about it. So who would like to be the questioner?
I'll do the question.
You're going to do the question. Great. Okay, so come on over here next to the mic. Sorry, format I forget about. And so what I'm going to ask is I'm going to task you with only using closed questions, okay? And I'm going to task you with being a little bit tough on her, okay? So I don't want you to elaborate too much. Try and stick with the answer to the question that she asks, okay? So maybe come on over and near the mic as much as possible, okay? And whenever you're ready.
Sorry, I'm just trying to find out what her resolutions are, or?
Yes, so you can start with, did you make resolutions, or any closed question you'd like.
Okay, so did you make any resolutions for 2018?
Yeah.
What kind of resolutions are they? Is that like yes/no questions, or?
Yes, no question.
Okay, did you make any resolutions related to personal health?
Mainly, yeah.
Is it about exercising more?
Yes, mainly.
Is it about exercising more times in a week?
About 5.
Okay. So is it that you'd like to exercise more times in a week?
No, don't like it.
Okay. So, but your resolution, it was about exercising more times in a week.
Yes.
Okay. And have you followed through so far this year?
On some days.
Okay. Were the days where you didn't follow through bad weather?
No.
Were you just tired?
Sometimes.
I'm gonna cut you off.
Okay, thanks very much. What's your name?
Deborah.
Deborah, thank you so much. Stay here for a sec though. Stay here, sorry. So, Deborah, you did an amazing job. Can everybody give Deborah a round of applause? Rarely do I find that people can keep it going that long. So I commend you for sure. So I want to hear from each of you about how that felt. So maybe you could share, like, how did that feel?
It was a little frustrating because I didn't always feel that my question was being understood or answered the way I had hoped.
Annie, do you want to share how you felt answering like that?
Sure. I had to refrain from going on and elaborating, but I did feel like the quality of the conversation wasn't as great when there were closed-ended questions.
Yes, for sure. I felt like it was going to take forever to get anything I wanted out of the conversation.
Yeah, it can be really circular. Okay, thank you so much. I love when there are brave volunteers. It's fantastic. It just illustrates so well. And thank you for sharing how it felt to actually go through that exercise. So, I task everybody here today to take away that exercise, try it out with a partner later. And then on the flip side, I will ask that you try instead to only use open questions. So we don't necessarily have time to do a lot of fulsome activities today, but this is just something that we can try out to get used to that balance in terms of open and closed. A lot of people share very similar challenges that you described in having those closed questions, but how many of us have had a bit of that conversation where it feels a bit shut down and the questioner is kind of searching for the right way in? Can we see a show of hands? I have, for sure. Okay. So even though it seems like that shouldn't happen in a natural conversation, it does. And we all feel it, and we just don't know where to go from there. And so open questions are a great solution there. Just changing some of those questions over to an open question takes a lot of the pressure off the questioner and doesn't necessarily put pressure on the person answering, but it just gives them some space to fill in some of that detail. It's a little less painstaking because you don't need to find the right way in. And even though some people are much more talkative and will fill in that space and talk over us even if we ask very closed questions, sometimes if it's a topic that somebody's not comfortable with or not familiar with, something that maybe they don't feel like they have the expertise in, and I use medications as a pharmacist, they may not fill in that space with all those details because they don't know what's relevant necessarily. And so this is a great exercise to try out and practice just to get a sense to avoid in our interactions. So skillful asking, though, is not just about only using open questions, because when you find you try that activity with the reverse, you also run out of time, run out of room, kind of run out of questions because you can't drill down only with open-ended questions. So it's about starting with them, using stems like describe. My favorite is tell me. I'm often, tell me about this, tell me about that, tell me more about this particular topic, just so that I can drill down a little bit. Switching questions over to what or how or, where, just to have someone kind of visualize something and fill in all those details that we're looking for. And we want to try not to ask 3 questions in a row because somebody often will feel like you're then peppering them with questions, and ask more open than closed, but neither exclusively. And then to avoid asking too many questions in a row, I will challenge everyone to try and use reflections as well to help gather information. So these are statements, but they also help to elicit information. So we're going to move on to reflections after this. So here are some examples of open questions that I like to use. And I'm sure many of you use similar ones. Describe a typical day, just so someone can visualize how it fits for them, in their home, in their schedule. Asking and normalizing, like a positive deviance. How often are you having difficulties doing your exercises, remembering to take your medication, following through with whatever plan you had decided on in the past? And this way, instead of asking, are you forgetting to take your medication, where the expectation is that you want them to say no, and then they'll give you that answer. Here you're normalizing it and allowing for, well, yeah, like twice or 3 times a week I forget to take it. Asking about the upsides and downsides of things is another way of skillfully asking open questions around the details of the decision making and what factors are impacting that decision. So, tell me about the benefits that you see from using, sorry, as a pharmacist, I said maybe your cane or your other assistive device. I often ask my patients in the pain clinic, okay, so now what are some downsides that you see about using your opioid medication or something that we're making a decision around changing, just so that we can start to develop that discrepancy between what they're doing and what either they want to do or what they know might be better. Okay, so reflections fall under not only responses but skillful listening, and that came up in the video as something that we want to be able to do as part of motivational interviewing. And so skillful listening is about offering some of these other types of statements, reflections and summary statements throughout. They really help us to check in with the patient and also show them that we are listening to them. So we want to use the nonverbals. We'd like to use the, I see, yes, okay, and what else? The encouragement so that people keep talking to us. But we also need to be comfortable with silence, because sometimes people need the time, like you mentioned, to fill in that space. And that's something that I've struggled with over time as a very talkative person. I at first had a really hard time just letting some silence happen. Sometimes I count in my head even 3 seconds, 5 seconds, so painful sometimes. But people who are a little more withdrawn or maybe are thinking through things that have happened in their week, that just gives them the time and the space to tell me what they came to say. And also I encourage people not to be distracted by their own thoughts. Sometimes, when 3 seconds of silence is going by or 5 seconds of silence, we're so busy in our days, it's easy to think about what we're doing next or what time it is. But we really need to stay in the moment and stay focused. And so what types of statements can we make to show people that we're listening? And one of these is the reflections. And this is increasing, so it's not just about being empathetic, but it increases the possibility of somebody seeing you as being empathetic. And it's selecting something that the person has said, just a part of the statement they've just made, to explore more deeply. And this is how it can act as a way of eliciting information. And so there are different types of reflections. There's the simple, where we are just paraphrasing and saying what the person has just said to really help emphasize it and explore it more deeply. And then there's the complex, everything that's happening under the surface. So whatever is driving that statement, it's the feelings and the intention and the hopes and all of their past experiences around this that might be driving what they're telling us. So there are different levels. These are the ones above the surface. This is maybe where we just parrot something. So somebody comes in and says, I'm just so frustrated. I can't believe I have another dose. I've been working so hard at this. And you just say, you're really frustrated. And so sometimes that can feel a bit artificial, but of course with the right emphasis, that does work, because people see that you're listening to them. You heard what they just said. Instead, you could try paraphrasing. Also just thinking of what's on the surface. So, you just got a new diagnosis. That's really tough. And, they really can feel that you got the gist of what they're telling you. Then there are these deeper levels, so where we start to reflect feelings and linking them to the content that we're hearing. So certainly it's a lot easier in context when we're talking to someone, but we can try it out with a few statements that I have that I hear very commonly. The other piece of reflection that we can use to our advantage is reflecting the extreme. So if we hear someone who is very resistant to doing something, and they say, like, I'm definitely not stopping my opioids. Don't even touch them. Do not touch my medication. I might reflect something to them to the extreme. So you always want to stay on these opioid medications. You can't see yourself without them. And, that can often help develop that discrepancy, no matter how small it is. People can say, well, I don't know if I'm going to be on it forever. I don't know if I'm going to be on it my whole life. And that's like a starting place with someone who's very, very resistant. So we can try it out a little bit. Some of you may have had some practice with this. And so what I suggest as we're starting is to use some good opening phrases. So it sounds like, or so you mean, or so you're saying. If someone were to say to us, pain will always be a part of my life. Why should I make this change? Someone who's resistant, maybe. What could we reflect as part of that statement?
It sounds like you feel pretty hopeless about your situation.
Yeah, that's that feeling, right? That's really driving that statement. Thank you so much. It sounds like you're pretty hopeless. Yes.
So you think that you're going to have pain for the rest of your life?
Right. So you think you're going to have pain for the rest of your life. So you're selecting that piece to explore more deeply. Thank you for sharing. Anyone else have something different? Yes.
It sounds like you're content with the way things are.
Sounds like you're happy with the way things are. Thank you. That's a great one to develop that discrepancy, really using that extreme. I love it. So there are, oh, you have one to share?
I was just going to say, so you think making that change will not affect your pain?
So you think making a change won't affect your pain? Yeah. So you think nothing will work for you? So you've tried everything, right? So all those, and that feeling of hopelessness kind of driving all of those paraphrase statements. So what I'd like to really draw out of this is that, for any statement, we can select different pieces to reflect, we can select different feelings, we can really select different pieces to explore. So it's not necessarily about just making like a generic empathy statement, I'm showing you I'm listening, let's continue. It's really about using this skillfully to then do a deep dive and make a connection with that person that we might not know that well. Sometimes we're seeing people for the first or second time, and we want to make a connection as soon as possible. And showing them that we're listening is one of the best ways to do that. So we'll try one more, because reflections are something great that you can take away. And if you're not already using them, just start to use them, in the next interaction that you have. Try one out. If you're wrong, and a lot of people tell me, I'm concerned. What if my hypothesis is wrong? What if that's not what they're feeling? What if I don't have that great intuition? That gives the person an opportunity to say, that's not really what I'm saying. They will appreciate your effort, as opposed to just not listening and not trying. So let's try this one. Someone comes in and they are sick and tired. How I live my life is my business. Stay out. Yes.
So it sounds like you like your privacy?
Sounds like you like your privacy. Great. Yes.
Sounds like a lot of people are interfering in your life.
A lot of people are interfering in your life. Yep.
Sounds like you're tired of getting advice.
Yes. You're tired of getting advice. And that's what I was formulating in my head too, thinking, you're tired of everyone telling you what to do. You're tired of everyone else thinking they know what's best for you. And I've used those because people have said this to me, different versions of those reflections in the moment, and it has really diffused the situation. So it's just anecdotal, but like I mentioned, take this away, try it out, see how it works for you. I found it's been very effective. So summaries are another way of showing that we're listening. And summaries don't just need to live at the end of our interaction, So we've talked about this and that, and thank you for coming, and do you have any questions? They can also be used throughout our conversations. And there are actually 3 kinds of summaries. They can be this collecting piece and then add at the end, what else? So maybe when we're moving from one topic to another, or maybe to make sure that we've gotten all the pieces. We may want to link things together. And that's where my question around the upsides and downsides of things often wind up in a summary. So on the pro side, you've told me about X, Y, Z. And then on the downside, you also see some of these. I just kind of show that out there for them. And that usually gives them a way to continue that conversation, to explore it more deeply without necessarily me imposing, what I think about the situation yet. And then transitional can also be helpful. So if we've gone down one path, I used to work for WSIB assessments, and sometimes we spend a lot of time talking about the WSIB and all the frustrations that someone might have had with WSIB claims. So sometimes it's about pulling all that information together, noting it, and then moving on to a different topic. And so sometimes if I collect all those things, it helps me to transition to something else. So I often get the question, reflections and summaries, they sound kind of the same. What's the difference? So I always include this information. Reflections really should be brief. And as you're thinking about how that interaction went and you're trying to pick out the reflections, think about, was I just picking a small piece of the statement to reflect, or was I gathering several points that the person made? And that would be more of a summary. So I have time for another video. It's my favorite video to show.
I'm here to get validated. You are awesome.
Excuse me? You have an amazing face. You've got powerful features, man. Anyone ever tell you that?
No.
Then listen. You look a little down. And it may seem like sometimes people don't understand you. But someday, man, someday, people are gonna see you for what you really are.
You really think so?
Absolutely. You are great.
Any validation, please?
You are great, ma'am. You have amazing cheekbones.
Really?
Sir, yes. We have a situation. Where?
6 months ago.
What the hell's going on?
You've been through it. You know. You've had so much life experience that other people don't appreciate, but you know.
Plus you do.
They're not patronizing the shops. They're just coming to see him.
Oh, sir. You're in great shape. You work out?
Not for long. I do, actually. A bit. Yeah, thanks.
Young man, we are running a business here, not a social club.
That is a fantastic suit. It really flatters you.
You think so?
You guys work so hard. You are the backbone that keeps this place running.
It always felt like no one really appreciated it.
Yeah, our jobs are so stressful, and it seems like most of the times people just don't see it.
No, what you do is so important.
You know, I bet the boss would love to meet you.
You are great. You provide hundreds of jobs, sustaining hundreds of families. That's huge.
That's so good to hear. Most times I feel like people don't recognize that I'm just the big bad man on the hill.
Not at all. You give.
You know, I know some people who would probably like to meet you.
Mr. President, no matter what people people say about you, you have still got a great golf swing. God bless you, you do. You have a fantastic mustache. I bet Burt Reynolds and Tom Selleck look at you and get envious. I'm not kidding. Thank you. You're welcome.
So as you can see, that video is 17 minutes. Anytime that you're having a bad day, YouTube validation, it's the best video to watch. Never fails to turn my frown upside down, for sure. So, you know, I just love using that to introduce validation because it is so powerful. Oh, I've lost my slide here. Here we go. It is, you know, something that you can always reach for. Anytime that you're trying to build rapport or really seeing someone in a very negative space, this can really help to change the tone of a conversation, make it more positive. Affirmations, although it seems very simple and he does such a wonderful job of it, he's focused a little bit on the physical, you know, telling everybody he likes their tie and he likes their mustache and this and that. And that's not necessarily something that we can do in a professional setting or with our patients or clients or colleagues necessarily and have it land appropriately the way we want to. But individualizing validation, individualizing an affirmation can be very helpful in that setting and in all of our interactions because people so often do feel like that. That's why I let the video go all the way to the boss because people do feel the way that boss described. You know, they feel like they're underappreciated. They feel like nobody really recognizes the good in them. Sometimes in our day-to-day dealings with colleagues, friends, family, you know, we don't necessarily acknowledge something specific and personal about someone, and this can do wonders to turn that around and make that person feel amazing. And why don't we want to do that all the time with other people? So it's not necessarily about cheerleading, and that's why I say it seems so simple, but it's not always easy. So this is something else that you can take away and start to practice with, you know, colleagues. Never hurts. Try to make one affirmation today and really make someone's day better. You know, what I struggled with was avoiding like a cheerleading, like a generic, you know, you're great. And he kind of starts with that in that video, so I like to point that out. You know, you're amazing. You are wonderful. Because sometimes when people are feeling low, that doesn't really resonate with them. They don't necessarily feel like you're personalizing it for them. Like, you know, you're just a happy person. That's great. That doesn't connect with me. I'm down here. You're up there, right? So instead, making it very personal about the person helps, you know, you to really reach in and like show that you see them. You see them for who they are, and you are still validating something about them. You don't even need to necessarily get along with them, but you know, and George Bush is in this video. You know, you don't necessarily even need to respect someone, but you can certainly still validate something about them, and that can sometimes be hard, but we still need to do it. We still want to work with people. We still maybe have roommates we don't get along with, or, you know, we might be in an interaction with someone talking about a change that they may have made, and they may feel very bad about the fact that they haven't had any success. So finding something to validate can really turn that conversation around. So here are some affirmations that I've used, but of course it's very important to personalize it, individualize it for the situation. So sometimes, you know, if someone has come in, they've done a lot of their own research, they have a lot of natural health products maybe that they want to talk all about, and, you know, maybe I want to just say like, no, you know, there's no evidence for any of this in this disease state. You know, that is first not an effective way to approach it, but also sometimes I'm wrong. So, you know, I'm much more open-minded, and instead of sighing because we have to go through all this information, you know, what I try and start with instead is an affirmation to change that tone and to really change my approach to the situation. And so I sometimes use the, you know, you've given this a lot of thought. You've done a lot of research. This is clearly very important to you. Those are all very true statements. They're very genuine. I'm making them from a genuine place, and it really does change even my approach to this situation. And then some other examples I don't necessarily need to read today. When I came previously, I spoke with the pharmacist group here, and they gave me some challenging situations of people that they've worked with in the past. Very commonly, especially in pain in my chronic pain clinic, people are still looking for that magic bullet, something that's going to take away their pain forever, like the stopper. And so, in a situation like that, it would be nice to start with an affirmation to create a positive tone. Is there something that any of you could pull out to affirm, not even knowing the situation? Yes?
I guess for the first point, it could be you're really committed to finding a solution.
Yeah. You're really committed to finding a solution. This is incredibly important to you. You are persisting, right? You're very persistent. Yes?
Because I know it's been really challenging, but throughout I've really admired how
You've never given up hope, right? Yeah, and you admire that. That's great. So, pulling out those strengths that is underlying that behavior, instead of just immediately jumping into, like, we've tried all these treatments or, resetting expectations. Sometimes creating a positive tone can be a really good place to start. I don't think we have time to go through the other example, but other challenging situations, you can reflect on your practice and your interactions. It's nice to work on, okay, what in this situation, what in this behavior, what in this interaction would I start by affirming? And that can be really helpful. And affirmations, and I like this video because he starts with you, and they need to be about the person. Not necessarily, I think that you are really persistent, or I think that you've done a great job, because sometimes that doesn't mean very much to them, especially if they don't have a relationship with you, but it's about them. It's about you. So that's really going through ORS very quickly in a nutshell, with a few examples and a few things that hopefully people can take away and start practicing today, or building on things that they already have in their practice. Skillful informing, and just in the last 2 minutes, is the last piece. So asking, listening, and informing. We often try to download as much information as we can. As pharmacists, we're trying to counsel on medications. It's like very old language, but it's still stuck in many of us who are trained that way. And so instead of counseling, which is like very one way and unidirectional, motivational interviewing challenges us to have informing as this exchange of information. And it's really about checking in with the person as you go. And so it's starting with asking permission, finding out, are they ready to receive this information? Are they in a space where they're ready to get some information from us? And these are some ways that I might frame that. And then I didn't include it, but giving a small chunk of information and then checking in with them. So asking them, how does this fit for you? Does that fit in with what you already know about this topic? And that kind of checks against their existing information and starts with that exchange. And so I just wanted to leave everyone with another acronym related to motivational interviewing, because I find it very inspirational. So to start using motivational interviewing, we want to resist that writing reflex, to be able to understand our patient motivations and skillfully listen to people and ultimately empower them to make changes. So that's my presentation today. Thanks so much.
Thank you. So just on behalf of Blurview, I'd like to thank Laura for coming and spending this time with us today. I think it really aligns nicely with a lot of work we're doing organizationally around strength-based approaches, and a lot of people in the room have probably participated in solution-focused coaching, where we can see some alignment with that work. So thanks very much. This is another tool in our toolbox of how to be facilitators of change for our clients and families. Thank you so much.